Yesterday, my 6-year-old started having an attack of extreme left-sided chest pain after eating. He commonly gets gas and indigestion, so realistically, I knew it was probably that. But he's still my baby, so I was still getting anxious, wondering if it was something cardiac or whatever. I do struggle with anxiety, and I started having anxious thoughts about having to give him CPR, him having a CHD that's gone undetected until now, and all kinds of bad stuff. It didn't help that we were at Walmart while this happened, and he was sitting in the cart crying, "Help me!" We had to leave Walmart, and he could barely walk to the car. When we got in the car, I called my mom because I didn't know what the freak else to do. My heart was racing at this point. Then my husband says, "But you're a nurse!" Anybody else ever get told this in hard personal situations? Like, when it comes to my kids, it doesn't really matter that I'm a nurse. I still feel helpless when they're sick or hurt. When it's my husband or another adult family member, I can give nurse help. But when it's my kids, I just can't. Anyway, I gave my son some methicone, and then his pain went away within 10 minutes. But the internet's reaction changed everything. That's where the original poster left off, but the comment section had a lot to say. The top reply from Vintage Fly, with 755 upvotes, put it bluntly: "You are a parent when you are in the Walmart parking lot with a screaming child and no access to saturation, a stethoscope, X-ray, or ECG." That was Vintage Fly. Another commenter, Cisney, with 141 upvotes, weighed in. "You are a nurse, but you are his mom first. It's okay to say back to your husband, 'Right now, I'm a mom,' when he says that. Eventually, you will be able to slip into a more nurse role with your kids, but in the meantime, speaking to someone about the catastrophizing thoughts would be helpful. I have a friend that slips right into that same thought process and knows she can call me any time to talk her down. Do you have someone like that in your life?" Strong words from Cisney. Then Resident Sympathy 82 added, "It's very normal to suddenly lose your entire education when it comes to your kids. That is your baby and a huge reason why we aren't supposed to treat our family. We have major blind spots. If it makes you feel better, I jokingly told my husband he just had the man flu for a while, until we both tested positive for pneumonia. We also talked about how my daughter also had a headache when it came time to do dishes and other work. Learned she had scoliosis last summer. It happens." That was Resident Sympathy 82. Let me know in the comments which side you're on. Up next. A nurse asked if she could date a patient, and a risk manager with 800 malpractice claims answered. It wasn't a major medical issue, they just needed some IV antibiotics. But they were absolutely lovely, and I have to admit I felt a connection. For the record, I didn't make any moves, passes, or remarks. I just had casual conversation about our interests while doing assessments and setting up their IV antibiotics. I found out we have a lot in common. We are the same age, have the same interests, and genuinely made each other laugh. They gave me their number on their way out, and I'm tempted. Does anyone have experience with this? I was thinking about playing it safe and reaching out to them 2 or so weeks from now to allow some time to elapse from being in the nurse-patient relationship. The vast majority of people say, "Hell to the no!" laugh out loud, citing boundary violations and the potential loss of my license. Just to clarify, while on the search for a life partner, I don't feel it is unreasonable to ask this question. To those who brush it off as, "Why would you even think about reaching out?" Well, maybe because I'm a human being? Are you? I am not going to reach out. Maybe I will run into them sometime down the line. That's where the original poster left off, but the comment section had a lot to say. But that wasn't the worst part. The top reply from Arlington 2018, with 537 upvotes, put it bluntly. "The corporate director of risk management here, practicing on the West Coast since 1983, has handled about 800 malpractice claims and licensure complaints to date. I would be very concerned that your state board of nursing would consider this a boundary violation and do terrible things to your license. Your board may have actual guidance on this, and many boards want anywhere from 1 to 2 years to pass before having a romantic or sexual relationship with a patient. Your employer may also have a policy on this. I have handled about 30 boundary violation cases, and they rarely work out well for the clinician involved. I point out, though, that by nature of my profession, I only hear about the ones that don't work out. That was U/Arlington 2018. Another commenter, U/potential factor 570, with 451 upvotes, weighed in. I would pass on it and keep it professional only. I've worked with some nurses that did and got let go because of it. See what employer has for guidelines on it. Strong words from U/potential factor 570. Then U/KNZRN, with 194 upvotes, added, the law states a person is still considered a patient for 1 year after the therapeutic nurse-client relationship is over. This means a nurse should not be involved in any form of sexual relations with that individual during the 1-year time frame post-care. This is a Canadian law and what I would consider a good rule in general to follow, considering there is no actual law in the United States. Now, if you ran into him out in normal life within the next year, I'd say go for it. But I wouldn't text him from a number you gained as his nurse. End of reply from U/KNZRN. Let me know in the comments which side you're on.